Hello, everyone, and welcome. My name is Leanna Ramos, and I'm the Marketing Associate here at JMIR Publications. I'm excited to welcome you to today's webinar, which is part of our JMIR Mental Health series in collaboration with the Society of Digital Psychiatry. Today's session topic is co-designing digital mental health with youth from global principles to local platforms. So we will begin with that in just a moment, but before we do, I just want to call out a couple of housekeeping items. Firstly, all microphones will be muted during the webinar. However, we encourage you to engage with the panel by submitting your questions. You can do so by easily typing your questions into the Q&A box, which is located at the bottom of your screen, and there will be a designated time for the panelists to address them. Additionally, we want to let you know that this event is being recorded and the recording will be available on our YouTube channel. So that's all from my end. I'd like to introduce Dr. John Torous. Dr. Torous is the director of the Digital Psychiatry Division at Beth Israel Deaconess Medical Center, which is a teaching hospital of Harvard Medical School. He also serves as the editor-in-chief of JMIR Mental Health. So with that, I'll pass things over to Dr. Torous to introduce today's speaker and get us started with today's session.
Excellent. Thank you, Landon, JMIR, and the Society of Digital Psychiatry. To learn more about the Society of Digital Psychiatry, go to sodpsych.com. But I want to introduce today's fantastic speaker on this topic. So Dr. Laura Ospina is an assistant professor at Javeriana, which is a leading university in Bogota, Colombia. She's a child and adolescent psychiatrist with over 15 years of experience, but her work combines psychiatry, technology, and participatory methods to design and implement digital tools for youth mental health with a focus on cultural adaptation and reducing the gaps in low middle income countries. Her work has been published in many journals, including JMIR and other ones too, and internationally supported. So without further ado, I'm going to hand it over to our fantastic speaker, and I'll rejoin for some question and answers at the end. So over to you, Laura. Thank you so much.
Hey, John, thank you so much for the introduction. I would also like to thank the audience for being here today and the Society of Digital Psychiatry and the JMIR for the invitation. So I'm just going to quickly share my slides here. Yep. So no technology issues right now. Excellent. So yeah, what I'm going to talk to you about today is a little bit the experience that we have been co-designing platforms for young people here in Colombia. I would like first to acknowledge the research team and the young people that have participated in these projects throughout all these years. And I guess that we are all here because we understand the potential of digital health to improve mental health outcomes and also to improve mental health access. But what I really want to highlight here is the digital health gap between the global north and the global south. So there have been many research that has shown that for us, people living in other countries, in low and middle income countries and countries that do not speak English, the availability of mental health apps, mental health platforms is really scarce. And not just the availability, but also the quality, the evidence base behind, it's really low. So we're facing not just a mental health gap in general, but we are also facing a digital health gap. And for the past decade, that has been like my passion thing, that has been my driving force to advocate for to how we can reduce these digital health gaps, not just in my country town, Colombia, but also in other low and middle income countries. So basically, I would just like to take you a little bit back. My journey started in Australia a decade ago, where I started doing my PhD, and things were really different in Australia at that time, where in Australia we were having a huge boom of digital health interventions at that time, a decade ago. Australia was having a lot of public policy interest, a lot of investment, a lot of a proliferation actually of digital tools in the area, but not just the public awareness about digital mental health, but also a deeply involvement of young people and people with lived experience as part of this development of this process and this project. I was actually really inspired by that way, because coming from Colombia, I haven't seen before young people and people with lived experience working collaboratively with the research team. And that was the first time that I realized that that was actually possible. So here in the pictures, you can see young people sitting in the center of the design process, and also how it was in Australia a decade ago, where that was something really important. At that time, a decade ago, Project Synergy was funded by the government. So we, like the University of Sydney, Professor Ian Hickey and the team led a huge movement of digital health interventions. And I was fortunate to be part of this movement. And part of my PhD and what I was doing there was to co-create a mental health e-clinic for young people. So we start doing that. We start doing that with young people. So we involve young people to create this digital clinic. We also involve clinicians, and we did this process having the young person in the center of the process. And then I said, okay, now that we have this e-mental health clinic, why don't we use it for people that are living here in Australia and don't have English proficiency? So as migrants, they do struggle with mental health. They don't have anywhere to go. They don't speak English. So I said, like, a digital tool could be a great thing for migrant populations. So we translated, we culturally adapt this clinic in Australia with migrant populations, with young people of migrant populations. And we developed the first prototype of a mental health clinic for a Spanish-speaking population in Australia. And then I said, okay, we now have this great e-tool in Spanish, so why don't we take it to Colombia? And that's where we take it to Colombia and try to adapt it to Colombia, again, with young people in the process. And that was a small, I will say a small project, but that was the beginning of something that has been part of my career. So we developed then a full methodology of how we can not just co-design things from scratch, but also how we can adapt digital technologies that are available elsewhere in the world, and how we can adapt it, translate it, culturally adapted, embedded in our context to make it an efficient use of something that has been proved effective in a high income setting, and how we can use it in a low income setting. So that's where we developed this methodology that was then published. And what we always advocated for is to have end users, people with lived experience, young people, and stakeholders at the center of the design, not just as consultants, not just as people that we go when things are finished and when we just measure if it's right or wrong. We want them to be part of the decisions. We want them to be part of the design process and have the same power as the research team, as the engineering team, in how these technologies should look like. As you know, the attrition of digital technologies is really high, and we think that when we involve young people since the beginning, the creation of something, they could use it more. So in this methodology, we involve young people and people with lived experience and users at the center of the design process. And we do workshops, we do knowledge translation sessions. In the knowledge translation sessions is actually when the decision making takes part, and that's where young people, it's also involved. And we do the content tailoring, the cultural adaptation with young people again. And then we go and do rapid prototyping, user testing sessions, again, with young people to see if we're going in the right direction or not. And the final steps is to the trials. That's the methodology. So in 2019, I returned to Colombia. Colombia, to provide you a little bit more of context, is a country with 48 million inhabitants. 1/3 of the population is young people, and we have a prevalence of mental health disorders around 10%. What we face is a huge difficulty on access to mental health care. Our treatment gap is around 60%. That means that from 10 people who needs to see a mental health specialist, just 4 of them can have access to them. And that's where digital technologies, we know that have a great impact and a great place. And that was the moment that I said, I have to take all this knowledge that I have to Australia, to my country town. So I arrived to Colombia, I arrived to my university. This is a picture from my university. And I said, okay, now what we do? So I arrived to this, again, to Colombia where the culture, the academic culture wasn't really aware of young people involvement in this decision-making process. That was actually really new, the co-design thing, the digital health thing. Everything was really new and innovative. And thanks to my university, I have a great place to start playing with these ideas and a lot of freedom to take place and to take action. And that's what we started to do all these things that I'm going to show you. I'm going to show you three different tools that we have developed today, and this is the first one that I'm going to show you. So we just said, okay, we need to design a mental health platform for young people to improve young people's mental health. How we do this? And we start doing participatory design workshops with young people. And if you remember the exercises that I showed you previously with the mental health clinic in Australia that had around 10 young people in the design process, this process that I carried in Colombia was massive. We had a participation of 110 end users in the design process. We had to do a lot of users testings again. And this is more a mirror of what we did with the end users. As you can see, the end users were mostly teenagers, young people, people with lived experience. So we start working with them, say, how would you design a mental health platform for young people to improve young people's mental health? We had to run the workshops online because it was the pandemic. So we had to develop an entire methodology how this could work online. And we also published that. I can share you the link after that. And the other myth that we wanted to debunk at that stage is that people in the lower socioeconomical status doesn't have internet or internet devices. So we actually involve a lot of vulnerable populations, a lot of people with low resources in this process. And what they told us in this process is that, of course, they love technology, they have devices, they have access to internet, and they really like the idea of having a mental health tool to help them to improve their mental health and well-being. So we start these workshops with discovery. We start saying, okay, would you use a technology to improve your mental health? How would you use it? Where do you use it? When would you use it? These are some of the ideas that were taking place in these online focus groups. And then the people started to create online how this system would look like, what the system would have, how many times they would engage with the system. And they started to create the system, the platform by themselves. They also said, okay, we want because mental health is so broad, which kind of areas of mental health do we want to target? Where we want to put the platform? Who would use it? And this was all part of talking and working with them. And also then the presentation, how would the platform would look like, how the results should look like. Do you like these graphs? You don't like these graphs? And as well, after each workshop, we have our knowledge translation sessions, which was where the decision-making process takes place. And we also involved young people at the center of this decision process. So young people were sitting with psychiatrists, with psychologists, with researchers, with engineers, trying to make sense that all the things that were discussed in the workshops were truly reflected in these knowledge sessions, and the decision making was reflecting what they said and what they want. So finally, the platform that we end up co-designing looked like this. So it's a platform designed for the help-seeking process. So sometimes, a lot of times, young people doesn't really know if they have a problem or not. So they really want to interact with a platform where they can provide some information, and then the platform can tell them or guide them if they need a problem or not and what to do with that problem. So basically, the young person will see an advertisement on their social media, and the advertisement would be a generic question that they could relate with. And then when they click to that advertising, they can have two options. They can browse the platform anonymously, or they can register. If they register, they put the demographics, they make a mental health screener, and with their demographic results and with their screening of mental health results, the platform will provide automatic resources in 3 levels. The first level is if they want to have telecounseling sessions that I will tell you a little bit more about it later. They can have so through the platform. The other level is you want to monitor something in your mental health to know what's happening with you. And the other level is you can go and read and have more information about whatever this problem is happening to you according to your results. So then the person can decide what to do the 3 levels or just do one. If they decide to go and monitor, they can monitor 13 areas of their mental health and well-being that you're seeing here in yellow. So from stress to mood to anxiety to self-esteem to physical health, they can monitor them, and the platform will provide them with results. And the results are presented not just in difficult graphs to read. The results are presented in graphs that represent something meaningful for them. And for example, the graphs are represented also in things that they can relate in positive psychology. So we're not saying someone you have bad self-esteem, but you have to work in your self-esteem, for example. And then we also put some of the things that were really important for young people. So for example, gamification. They really want to have this platform with a gamification component. Therefore, they wanted an avatar. We created an avatar for them. We also put a well-being plan. And after that, the usability score of the platform was 5. So we're happy to put that prototype on a trial. This is the paper of the entire co-design process to the testing, to the naturalistic trial testing that you can take a look. But basically, when we put the platform in testing, what we find? We found that 450 people interact with the platform. Even if we designed this for young people, the median age of use was 34 years. That was meaningful for us because we thought a lot of people want to use a platform. It wasn't restricted by age. The majority of the people that use of the platform were female. And what we found was a correlation between the use of the platform and the level of distress. Young people that were using the platform reported higher levels of distress. And then the other thing that we saw is that, for example, things that they really like at the beginning, for example, the avatar wasn't really used like the other things, for example. And people who use it, mostly of the people use it for 1 day, but the people who use it for more days, for more than a month, reported higher levels of distress. And that was the first platform that we designed. Then we said, okay, we need to design more things. That was all simultaneously. So we decided to design a psychoeducational website because psychoeducation is really important and people were not having a source of psychoeducational resources that was valid, that was evidence-based. So we co-designed this psychoeducational website again with young people. Again, a massive exercise of co-design, 267 people participated, one for the content and one for the interface. A lot of young people, a lot of teenagers and young adults participated here. This was after the pandemic, so we could run the workshops face-to-face. And we also run them we also put young people in the knowledge translation sessions where the decision-making process was done. And this is how the platform looks like. So people could actually enter to the website and select a profile. So if you're a child, if you're a teenager, if you're a parent or a carer, or if you're a teacher, all the content inside of each profile is tailored for your age, for your topics, and also the way, for example, if we're talking about children, you will have more videos, more animated videos. If we're talking in the profile educators profile, we'll have more, PDFs or something that they can read with more evidence-based information and things like that. So everything is skewed for the level of literacy and their interest on mental health. We also have online forums. We also have a chatbot that guides the person to which kind of resource could be more suitable for their needs. And this is the link of the website. It is the only website available in Spanish for psychoeducation. So we have more than 150 contents co-created with people. So the interface and the contents are co-created. And we launched it a year ago. And today we have around 26,000 users who have entered to the platform. The other tool that I'm just going to talk to you is, okay, we have psychoeducation, we have help-seeking process, but we need to expand the mental health care. And to expand the mental health care, this platform that I'm going to show you wasn't really co-designed because we didn't have time, but it's a student initiative. So when the COVID hit, the students came to us and said, look, we are very concerned about our fellow students that are here in quarantine and they don't have anyone to talk to. And we want to support them, calling them or chatting with them. So therefore, with the students, in a very, very quick process, we create Collective Minds. Collective Minds is a telecounseling service that works Monday to Friday from 7 to 7 a.m. and it's totally free of charge. And we were so lucky that the nursing faculty, the engineering faculty, and the psychology faculty came abroad, and we have been doing this telecounseling exercise for 5 years now, and we expanded. We are not just mental health right now, we're sexual and reproductive health as well. And as I was telling you, we're providing free telecounseling sessions from Monday to Friday, and we can have immediate sessions or we can have scheduled sessions, but the most important thing is that people can receive support by chat, by video call, via traditional landline, or by mobile phone. It really depends on the person and what they want. And that's another kind of specific area. We have put together a paper. We have analyzed who our users are. You can have some information about the results here. But basically what we have seen is that young people that use our services report high levels of distress. And that's really important because our line is not an emergency line. It's not a suicide hotline, because we just have referred 5% of our users to emergency services. People are really using it as a transition to cope with some distress or whatever needs that they have at the moment. So as a bridge between traditional care and us. And we have reached 30 out of the 32 departments in Colombia. We have supported Colombians abroad. We have also supported other people from Latin America that don't have these services. But the other thing that I want to highlight is the work that we have doing with the community. So we have do a lot of work with the Amazon region that has very, very high rates of suicide and mental health challenges. And we have been doing a very in-ground work with them, working with the communities, working with the indigenous communities, of how we can gain trust and work effectively with these vulnerable communities. And so far, we have a lot of users from this region. And then, yeah, just to move on and to finish because the time is over. What are our future directions? Our future directions is to integrate these three tools in a comprehensive and interoperable ecosystem. And that's what we are moving forward. Also embedding teleeducation, or students at the university can experience digital health as students working with these kind of technologies, being part of Collective Minds, and know how to do an online counseling session. We're going to do RCTs with this ecosystem as well, and to move forward and find industries partnerships. We're also in that to sustain these kind of initiatives in the future, and how we can establish youth participation protocols in Colombia, because we need to empower more young people as leaders in mental health. We need to train them. We have to find supportive and safety places where researchers can work collaboratively with them and they feel safe to give their views and to provide their inputs to these kind of groups. And also a compensation. We have to remember that young people need to be compensated for their expertise and not do this voluntarily. So we have to provide as well frameworks of how we can compensate young people, being really mindful about child labor or other concerns with parental consent and everything. So thank you very much. This is glance of what we have been doing here in Colombia. These are my details, and yeah, happy to have a chat.
It's so impressive and it's so much, Laura. You've basically taken us from the beginning through an amazing journey to today, and there's a lot of great questions. I'll just begin them in rapid fire. How do you begin to fund all of this amazing work? Clearly, building technology has some cost and it has to change, and clearly you found a way to do it really impressively. What can you share with everyone on how to get it sustainable or get some initial funding to do this great work?
Yeah, I think that we have been really lucky because we have great partners. So we have been really lucky to have a lot of supportive partners in Australia, in Europe, in the US, so we can find collaborative grants who have made this possibly. And also the good thing about coming here to Colombia in 2009, it was that everything that we're talking about was really innovative. So our Colombian ministry was really interested on innovations, and this was really novel. So we were hitting the needs of Colombia at that moment. So yeah, basically putting a lot of grants together, getting a lot of grants rejected, and eventually getting 2 or 3 grants supported. But also when we're putting grants, thinking that this needs to be sustainable and thinking how this can be embedded in the university structure to make it sustainable over time. And that's it.
Yeah, and I think the collaborative nature of your work was very apparent too. You weren't doing this all alone. You're working with your mentors, you're working with new young people, the community. It's clear how involved everyone is from different partners. And I think that really is I think sometimes with technology, one thinks you can do it all on your own, and it's hard to do it that way. And I think those partnerships make it sustainable. You've done amazing co-design and community work. And again, someone was asking, what are the challenges when you engage with youth during co-design workshops and digital interventions? We have a lot of people on this webinar who are junior to the field, want to learn it. It's a little bit intimidating. It's easy to say I want to do it, but sometimes there are some common barriers. Or how have you made it work so well when you do these amazing co-design workshops and interventions?
Now, one of the first things that we have to acknowledge is that as researchers need to have a genuine curiosity about young people's ideas. Young people can sense when people are not interested about what they have to say and when they have to say something and they are interested. So that's where I was talking about. We need to find the way to create safe spaces where they feel empowered to talk. And I guess that's the most important thing. If we're going to embed young people in research structures, we have to be really mindful that we need to have this culture of young people participation, where it's not hostile, where it's really collaboratively, because they come with a lot of preventions that have been tokenized, they have been used, they come with a lot of preventions. And I think that the genuine curiosity of hearing them in a respectful way is the most important thing to establish since the beginning. And when they are on board, I think that they are my inspiration. I mean, they are the force that move this process. And once we're lucky to have them on board, it's easy, everything flows.
Yeah, and a related question is, clearly you're doing this to make sure the tools and services are engaging for young people. This question is, I wonder if you've ever have any thoughts about how to engage youth without elevated symptoms of mental health to use digital interventions as preventative tools. So clearly we'd all like preventative mental health. Can digital tools solve prevention? Can we engage people who aren't feeling as acutely ill?
That is it's a really difficult question. I think that it all depends of how we can frame it. I think if we frame it mental health more on the well-being side, more on the emotional regulation side, or more on the well-being side, and the language that we use goes more in that direction, we could engage them more. But also we have to be mindful where we put this piece of technology and who's going to use it, right? Because working with youth is not just working with young people, it's also working with their parents, with their carers, with the teachers, and everyone needs to be involved. So if young people want to use an app or whatever that we have designed, but their parents don't want them to use the app, or the school is hesitant, we're not doing much. So I think that the field of youth need also to include the other perspective views that are the facilitators or the barriers again for using it. So when we're talking about well-being at schools with people with no problems, we also have to be mindful to use a language that could relate it, that the young person could relate with, but also their parents and their teachers.
Yeah, so that makes sense. And again, all your co-design workshops, we can't just say CBT works well for people with depression. Thus, we're going to take the same CBT app in this study and now use it for prevention. We have to have a more thoughtful approach than just saying it works here, it works here. You anticipated a second question. Of course, some people are concerned that too much screen time harms youth. They're exposed to bad content. How do we balance using technology as a way to deliver mental health care when there are some concerns we're learning more? It may not be that screen time isn't that toxic, but there's definitely people are worried about phones and mental health for youth.
Yeah, I think that I don't know. I think that we are in the middle of a revolution that we are not. I mean, we don't have yet the answer for that. Perhaps
Yeah.
in 20 years we would have an answer for that. I will say why you're using the screen and what for is more like it is more the important question here. Because I'm totally sure that no one would debate of reading or studying in a computer. There will be more debate if you're there playing games or watching, I don't know, YouTube videos that doesn't lead to anywhere. So I think that if we can balance the thing of course, for the eyes is another thing. Like we don't want much screen time for the eyes or during the nighttime, whatever. But if
Yep.
it's meaningful, it has a purpose for them and it's for the good. I think that we can balance that thing. And to be honest, well, screens are part of our life, and I don't know how much we cannot use them anymore.
Yeah, no, it's definitely a balance, but I agree it's not going to go away, and we can find ways. Like all things in healthcare, we have to minimize the risks and maximize the benefits. We'll end on one final question for sake of time. This is a hard one, so whoever put it, you're gonna test us. But again, what is the toughest challenge you faced throughout from having idea of the platform to releasing it? What has been just the number one barrier and a little tip to kind of people who want to do the amazing work you're doing on how to overcome some of those barriers? And perhaps we've covered it or not already, but I said we don't shy away from the tough questions on our webinar.
Look, I think that there are always going to be problems, or there are going to be barriers, and there are going to be always challenges. I think that maybe we just have to try to think differently when we see a barrier. I think that that's the thing. Just try to see the problem in a different way and try to see it out of the box, because I think that sometimes the solutions could be so simple, or sometimes you can solve things talking to another person or engaging a different stakeholder and things like that. In my opinion, the more people that you get involved with and you get excited with your idea is the best, because they're going to be the facilitators for your job. So I would say don't do it alone. Don't start thinking that you have a great idea and that you're going to do it alone. These people working in the digital space, I would say we are not competition. We are all like, we are working together to get this thing done. So I will say engage them, collaborate, get ideas, be the best friend of everyone that you can be, so you would get the force to drive your idea forward with your network.
I think that may be some of the best evidence we've had on this webinar, because even though digital, the idea is simple, no project ever goes straight from A to B. And technology changes, what people need changes, the state of the world changes, and having that right team or support to kind of move with it means you'll develop what the world needs in it. So I think that's a wonderful way to end. I want to thank everyone for joining. You can visit sodpsych.com for more webinars, upcoming events, and training. Thank you so much, Laura, for taking time to join us and sharing so much, and to the JMIR team for producing this. Till next time, bye.